Well, hello everyone. My name is Erica Schroeder-Cerda, and I am with LivWell Seniors and LivWell Cares, where we provide free information referral services for seniors and their families as you're navigating future needs and, if it's a crisis, immediate needs. And we can help to identify what those are and keep it as stress-free as possible. And so today we are here to talk about caregiving and who it impacts and the constant struggle for the caregiver to find the balance in their lives, because it's a lot when you're trying to work full-time, you're trying to take care of your own family, and you're taking care of loved ones. And so I've been there myself a couple times, and it really can be a lot. So we really want to honor that and find some solutions for you, or at least help prepare you for some options that you might need down the road. I'm just going to run through some stats right now just to talk about where we stand collectively with everything. So we're an aging population, we're living longer, and due to the advances, that's because the advances in disease management and treatment, that we've got medicines and treatments to take care of these things, that people are living longer, but not always necessarily healthier. So we were looking to help find ways to make that a bit easier for everybody. So right now we're at 55.8 million seniors. And so that looks like having 10,000 Americans turn 65 every single day. And that by the year 2050, we're projected to have 88 million seniors in the country. So that's a lot to consider. There's going to be a lot of need coming forward. And that really is coming from the AARP 2021 Aging and Readiness Competitive Report. And so what that looks like is that in Iowa, the percentage of that is going to be around 18%. So who this is impacting, we've just gone through a few of these already, but the 55.8 million are 65 and up, 10,000 every day are going to turn 65, 88 million are going to turn 65 by the year 2050. 1 in 4 households are going to be providing that care. 1 in 7 we're going to be providing financial support, and that equates to 53 million unpaid family caregivers. So breaking that down, the age does not discriminate. We're seeing the needs that are happening more and more often, younger and younger, that there's some needs that are coming from the aging people. And so what we're looking at is that 1 in 7 middle-aged adults, so that's 15%, are going to be provided financial support to both an aging parent and a child. That can be really concerning. And so almost half of the adults aged 40 to 59 have provided some financial support to at least one grown child in the past year, with 27% providing the primary support. So the baby boomers themselves, we're going to spend more years caring for the dependent parent than they will be for the child, the children. So it's something to consider for sure. Looking at who this is, and again with just kind of detailing some things, that overall 75% of the caregivers are women. So we're talking to the adult children who are women, and 50% more providing care than men. It's just the statistics. So we know that there's lots of diversity and variety there. There's 100, that's going to impact 148 to 188 billion economically as we're looking towards those needs in the future. And so 1 in 5 caregiver employees provide care. And I think that that might even be a little bit of a stretch now. I would say from the families that we are connecting with, it's becoming more and more frequent. And so I think maybe even 1 in 4 is starting to become a caregiver to their parent, and the adult working child is becoming younger and younger. So another thing to consider is that many of the caregivers are spouses caring for their loved one. And so when we're looking at the statistics there, that equates to 44.6 hours a week. That's a full-time job. It's just incredible to think about that. And so, it's happening younger and younger, and we might even find that we're talking to talk to spouses that work full time and they're also looking for help and assistance for their partner, for their loved one, for their spouse. So that's on top of working and then also providing these cares. It's a lot. It's definitely a lot. And 53% report higher levels of emotional stress because of this, because of the need, because of the great need that is present, and the challenges that they're finding with that. What does that look like, really? So oftentimes this is going to be the role reversal, where are you parenting your parent? And an example might look like 73-year-old mother. She falls over the weekend, fractures her hip, goes to surgery. She goes into skilled care rehab for 30 days. You've got 3 adult children, and none of them live local. They're all living around the United States. But they're all working full time and sharing the load. So they're sharing their time going back and forth from their job back to help mom and her needs. And so they're using their PTO and their vacation time to do this. Just to try to handle that transition. So now mom's being discharged. It's not safe for her to return back home. She needs assisted living. So now they're trying to make things work. Mom's saying, I want to go back home, so let's just hire some cares. So they're going to consider looking at around 8 hours of care, but that's realistically not enough. So she's going to have to rely on friends and neighbors, because again, adult children aren't local. And so what that ultimately has looked like is that, then we get a call saying, I literally just got this call last week that she said, now that there's some dementia involved as well, my husband flew down to Texas because of the calls from the neighbors and the bank saying something's not right. There's some confusion happening. So he flew down there, put mom in the car, drove her back here to the Quad Cities, and now she's living with family. And the adult daughter says, I have no idea what to do next. So it's just such a challenge, and it's happening more and more often. So they have to assert themselves in more of a situation to do that. So we get this a lot. Why bother researching? If I can't get mom or dad to do anything, why do I even bother looking? What's the point? So oftentimes the reasons for this is because there's fear. There's fear of what's going to happen to me. I'm going to lose my independence. There's denial because, they don't see themselves aging or getting along just fine, so I don't have a need. Or it's just too overwhelming to consider. There's so much to consider with all of this, with the cost, with the different levels of care. It's so much. It can be a lot. So they make a decision just to do no planning. So what happens then is that if there's a crisis that happens, it typically falls on the adult children's shoulders. And at that time, then, and I've lived through this myself with my own family member, where my dad had a stroke and he was living in Florida. So I took my PTO time and needed to address the situation at hand. So everything is put on pause, your life. I had to put everything on pause while I addressed the crisis at hand, and it was very stressful, even when I knew what to do. So what you want to do instead of this is be proactive. Gather this information ahead of time so that when and if something happens, you can plan on the best or worst case scenarios. And then you've already done the research, you've already gathered the information, so you have some sense of what to do if something happens. But really the key is to have somebody coach you through all this, and we can get to that in a little bit too. So where do you begin? As the caregiver adult child, there's so many factors to consider when you're looking at some options and additional caregiving responsibilities. And so how do you even know where to start? So it can be information overload. It can feel stressful and overwhelming. There's so many resources out there. And oftentimes with any questions that I have, I go to my phone and I'm going to Google information. And then you go down the rabbit hole of the internet, and then you're getting so much information that might not even be relevant to my set of circumstances. And sometimes you might even, unknowingly cast my information out there, and now I'm being bombarded by resources that just, I'm already stressed to the max. So I don't have time to address all these extras that might not be relevant. So the things that you really need to be concerned about and looking for is going to be, is it too soon to start looking for senior living options for my loved ones? What is it that I need to be looking for? What kind of cares and amenities? The costs. How do I begin the process of looking to the options of what's needed? And is there anyone to help me do all of this, basically? So some of the options we hear are staying at home, which could be a possible option where there's lots of things to factor in to consider if that's going to be one of the best options for your loved one. So the questions to ask: are they becoming more dependent on others for daily routines? How is their medication management going? Are they able to take the right medications at the right time and the right dosage? Are they maybe dropping any pills and finding them on the floor? What about grocery ordering and doctor appointments? Maybe some meal prep. Are they having some trouble with just the day-to-day things, showering? How about their eating habits? Is that getting a little bit worse? Are you noticing maybe even some spoiled food in the fridge? Things to consider there. Or even the ability to drive, noticing any dings on the car or just some things that never used to be there. So lots of things to think about when we're considering these. And then also with caregiving, what does this look like logistically? Are you able to provide these cares? And so often when we talk to families, they say, well, we're not really sure if, what stage or what level that my loved one needs. And when we go through a lot of the things that the adult child is already doing, they don't realize that you are their assisted living. You are providing that opportunity for them to be their assisted living. So when you're considering that, are you both going to live in the same area where you can provide that? And does that make sense for you and your time schedule? Is it looking like, will you or your parents relocate if they have needs? Are you able to work remotely? So it could be easier for you to still continue to work and then still be able to do your job, and as the expectations are met there. Looking at their home, is that going to sustain them and physically? So home modifications might be needed. Can they still safely make it in and out of the shower? Okay. What about the laundry being in the basement and there's stairs to contend with? There's just a lot to consider in having that option of staying at home work out well for them. There are things to consider when we're looking at finances. So this caring for an aging parent is more than just all of their physical needs. It's really about looking at what they might have available for them as you're considering their needs might increase down the road. So we're looking at healthcare costs. We're looking at some long-term care planning. Do they have any long-term care insurance? Even just health insurance changes so frequently. So someone to help manage that is a lot as well. And just navigating all of that can be really overwhelming. So when we're looking at types of care, there's so much out there. We talked about help at home with that scenario with the family, looking at that. So when we're looking at help at home options, that can look like someone's coming from an agency that you've hired at a set schedule the same time every week, and that can be determined with the agency. You'd want to determine what works best for their schedule and what their needs are. But an example of this could look like they could come every Monday, Wednesday, Friday and help get mom ready for the day. And then you would come on Tuesday and Thursday to fill the gap and supplement those needs. So they can do things like medication reminders. They can do things like grooming, bathing, prepping some meals, errand running, and companionship. And so that's what help at home looks like. The cost for that is going to be around $35 an hour. It varies a little bit here and there. It can also depend on the number of hours per week. But when you're getting it around 6 hours a day, that equates to around the same cost as it would be for assisted living 24/7 around the clock care and everything included in that. So something to consider there. The senior living communities that are available, there are independent living where there's apartments that may or may not include meals. They really vary, but the cost can start on the low end at around $2,500 a month. That's not across the board, but this is just an average about what's available. And it can go up from there. It depends on the size of the apartment, the location. Sometimes it can depend upon that and what's included. Sometimes there's garages included, sometimes utilities, cable, etc. And so there's lots of activities that they can do in independent living and have some things to do with their peers. The next level of care is assisted living, and that can start off at around $4,800 a month. That may or may not include cares. Sometimes there's an additional level of care cost that comes into play there. But with overall, the assisted living includes everything with independent, but you've got a button to press in case you have needs throughout the day or night, and you have a set plan that is set up between you and the nurse there that can help navigate what that would look like in any given day. That would include perhaps bathing and showering, grooming, and the full medication management there. And then with memory care, that starts off at around $6,000 and can go up from there. So that is a very specific type of assisted living that's structured in the way that your loved one has some dementia and needs really some more oversight. And this is typically a secure community, but they have their own space and their own things and have the ability to have some oversight while they're there. Another option is a continuing care retirement community. That's abbreviated as a CCRC, and that's where a campus has all levels of care on the same campus. So not only do you have to consider which senior living communities have which types of care, but some don't have everything included, and it may or may not be relevant to your set of circumstances. So that's really just another thing to consider. Some of these have entry fees plus rentals. There's also some offer respite care, and that's where they offer some type of short-term stays. So perhaps you're the adult caregiver and your daughter is getting married in another state and you want to participate, and so you'd hire someone to provide that respite care either in home or out of the home, and that can look a little different as well. So it's typically used for some vacation time or time away, and it's for typically a minimum of at least 7 days. Some places are really leaning to at least a 2-week minimum, but not more than 30 days. And then another level of care is nursing, skilled rehab. So that would be determined by a hospital visit. Something has happened, whether it's pneumonia or some kind of fracture. They get discharged from the hospital, and they would go into a skilled rehab where they would receive therapy in order to help them get stronger, so that the goal would be to be discharged at their highest functioning, physically, cognitively, whether that be home or to another level of care. And then the nursing long-term care, that can range at anywhere from $8,500 up a month, and that's the highest level of care, where most people term this a nursing home, and it's the 24/7 acute level of care. So lots of different ways to navigate all of those and determine which ones are best for your loved one. Lots of different payer sources as well. So the majority of what I've talked about in the prior slide, most of it's going to be private pay. There are ways that families look to do that. They utilize the sale of their home. They utilize their monthly income. They utilize any asset. And some people have long-term care insurance, and there's lots of variety there. I always tell people that long-term care insurance is just, it's a mixed bag. It really depends because each policy is unique. They're like a snowflake and no one is exactly alike. So it really depends on their policy as to what it will pay for and for how long. Medicare does not cover assisted living or long-term care nursing. Many people they are not aware of that. And so that's something to know, that Medicare, the insurance that you get when you turn 65, does not pay for any of this. What Medicare does pay for is that rehab short stay after a hospital or some type of crisis. That's the only time that Medicare will pay for something like that. Otherwise, you're reliant on some long-term care policies will pay for help at home services. Perhaps some assisted living will pay for some of those. But also elderly waiver or Medicaid will step in, but you have to spend down all of the resources before Medicaid will pay for some service there. And then there's also options for VA benefits and aid and attendance. And so that's sometimes applicable for wartime vets, their spouses, and the surviving spouses of wartime vets. And there's some criteria there that we can help guide you to determine that if that would be appropriate for your loved one's circumstance. So some of the documents that you're going to want to have ready for a successful plan will be a living will, powers of attorney, the last will and testament, and then of course keeping track of those digital accounts and passwords, which can be really challenging because they're ever changing. But to kind of go over the differences, and it's not anything that you need to know here and today, but we can help you navigate that if you need some more clarity. For the living will is the written statement detailing a person's desires regarding their medical treatment in circumstances that they're no longer able to express their informed consent, and especially like in advance directives. So the general power of attorney is that it's a trusted individual that you designate to make financial decisions, gifts, and health care for if and when you're unable to make those decisions for yourself. And so that person that you name might be called your agent, your attorney in fact, your healthcare proxy, patient advocate, or something similar. And then property power of attorney allows your agent to handle the financial affairs, income, bill pay if you become temporarily incapacitated. You've also got the financial power of attorney that allows you to make the financial decisions for the same. And then the durable power of attorney is the legal document that gives the person you assign the authority to make legal, medical, or financial decisions for another person. And this remains in effect until the person who grants it dies or cancels it. So when the loved one, at the time of their passing, that power of attorney does not carry through. It ceases at the time of their passing. So a lot of people are unaware of that as well. So then the last will and testament, that's a legal document that communicates their final wishes pertaining to assets and dependents. And then the digital accounts and passwords, a place to safely store all of those that can be in a universal file or in a protected digital app. So getting to the end of life planning, what that can look like, these can include discussions on palliative care, hospice, death doula. These are all different types of things that you can fold into this. When we talk to seniors about end of life planning, they'll say, oh, I've got my funeral already planned. That's all well and good, but there's more to that. So it's the things that can happen leading up to that needs some planning. So palliative care is a comprehensive approach to improving the quality of life while managing treatment with a life-threatening illness. Medicare will pay for that, and insurance. Hospice is a specialized type of palliative care that comes with a life expectancy of 6 months or less. And again, Medicare and insurance will pay for that. Hospice does not always mean the very end of life. I've had friends and family members that have graduated from hospice before. So hospice can really be something that just enhances their quality of life, and sometimes they get better and can sustain that for a while and then can return to hospice if it's needed. A death doula focuses on the non-medical aspects of aging and supporting in the emotional, spiritual, and practical cares. This can all be emotionally challenging, difficult to have these discussions, but really crucial to make sure that your loved one's voice is heard and carried out with their wishes. With all of this, it's a lot of information today, I'm well aware, but there is a solution that LivWell Seniors can help you navigate all of this, because there is no cookie cutter answer for every single family. It's going to be unique to each and every circumstance. And so, what LivWell does is that we are a free information and referral service. So, we help seniors every day. We know what resources are available and what will be a good fit. So, we can match up the right communities for the lifestyle, for the budget, for the need, the quality of life, and just package all of that together for you to come up with a plan and the next step. We provide you with that information so that you're not left on your own to call different places and say, hey, what about your community? Or, like I've previously talked about, where you try to do the research on your own on your phone and go down the rabbit hole of the internet, and then you've got different places calling, emailing, texting you, and it's just overwhelming. So we keep your contact information sacred, and we're not sharing that with any of the different senior living. So you can focus on what's important, what's most important, your loved one and their needs, and you can still maintain what you do to your day to day. And so with that, we also work on your schedule. So we can time, if needed, tours, home visits, those kinds of things as they're needed to help support your schedule, and here to help with that. And so the region that we can assist with is within a 25-mile radius here in the Quad Cities, but we also offer services across the whole United States. So we have entities that are like LivWell that we can connect you to if you have loved ones that live in another state and they want to remain there. So we can help coach you through all of those different scenarios, whatever those needs are. So with that, I want to thank you all for coming today, and we'd love to talk to you more about how we can be helpful to you and your family.